Welcome to the Cystic Fibrosis Foundation Virtual CF Education Day, Fertility Information for Females with CF, a webcast supported through an unrestricted educational grant from Genentech. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. Joining me is Dr. Edith Chang, Associate Professor of Obstetrics, and Dr. Moira Aitken, Professor of Medicine and Director of the Adult CF Program at the University of Washington. I want to thank everyone who submitted questions during registration to be answered. However, I do wish to clarify that we will not be discussing questions related to cost or insurance coverage for infertility treatments due to the variations between states and insurance providers. I encourage you to work with your care center, primary care provider, or OB to explore this issue. So, welcome Edith and Moira. So how does CF affect female fertility?
I don't think it does tremendously. I don't think that you can plan on that assumption. I think that there are different causes of infertility. One is, are you unable to become pregnant because you are not ovulating, which is a different process from are you unable to become pregnant because there's an obstructive process at the level of the fallopian tube, or an abnormality in the uterine cavity that is preventing implantation, or even an obstructive process at the level of the cervix that prevents sperm penetration.
Well, I have to touch on that cervix question since you brought it up, because we did get a live question about it. I assume because CF causes thickening mucus, that cervical mucus is also thickened in a woman with CF. Is that true, number one, and can that be used as a method of birth control?
Okay. So, the cervical mucus is definitely very thick. That is definitely true. Getting a pap smear is difficult sometimes, but I don't think that Moira and I definitely know that we have plenty of patients who have gotten pregnant thinking that their cervical mucus was an excellent form of birth control. So I don't think that if you are not planning a pregnancy that you should use cervical mucus as your form of birth control.
And Moira, you're agreeing. Is there any other thing you'd like to add to that?
Well, absolutely. And back to your fertility question, I do remember one anecdotal case, but it was true, that she wanted to conceive children, had been trying for several months, and following her pap smear, that month did conceive. And I don't think that was a coincidence. So we've seen that recurrently. So I think there is a mild fertility issue with the mucus.
But it's not
correctable.
It's not a form of birth control.
Absolutely not.
So what are recommended forms of birth control for women with cystic fibrosis?
Well, that's a very good question, and one that the CF community have been concerned about, because there were issues regarding malabsorption, that if you were taking the oral contraceptive pill, perhaps it would be malabsorbed. Or in cystic fibrosis liver disease, the metabolism of drugs can be upset. And so there was concern that these forms of contraception wouldn't be so effective. And we looked at that locally in our local patients, and we found that the women chose the same forms of contraception as happens nationally throughout the United States. The most common being the oral contraceptive pill, and the second being abstinence or natural family planning, with a third being the condoms. So those were the top three in our patient population.
And so there's all work as well?
All work as well. I think that, again, you know, family planning in our women with cystic fibrosis patients is really no different than really, the way to think about it is no different than family planning for any woman. If you do not wish to become pregnant, you need to use a form of birth control. And I think, as Moira has discussed, it looks like the usual form of birth control for non-CF women are just as efficacious.
So again, looking at broad reproductive health issues for women with CF, What about sexually transmitted diseases? I've seen more commercials about the HPV vaccine. You know, what are methods to prevent sexually transmitted diseases, and what about the HPV vaccine? What is it, and should a woman with CF consider it?
Well, I think that any sexually active individual should be concerned about sexually transmitted diseases. It is not a unique issue with CF, men or women, and women. So, you know, safe sex behavior, condoms is an excellent barrier for sexually transmitted diseases, as well as a form of birth control. So I think that these are all kind of common sense good health practices. I think that the HPV vaccine is a vaccine that's used to basically prevent infection by the human papillomavirus, which is associated with cervical cancer. And it is currently recommended for women who are sexually active.
So I got this in registration, which I think is great. And this is from a woman who's 26. She has cystic fibrosis. Her husband and her have been family planning and thinking about having children in about 18 months. They've talked with their doctor. He's going to be carrier tested soon. And she's wondering, is there anything else she can do to assure that she'll have a healthy pregnancy and a healthy baby? You know, how can she get herself as healthy as possible to be ready to have kids? What do you tell a woman like that who comes into your clinic, Moira?
Well, I think, first of all, I think we have to applaud this couple that they have thought so carefully about their reproductive decision making. I think that would be is to be applauded, and I'd say that most women with cystic fibrosis do think more carefully than the general public about reproductive decision making. I wish that we could guarantee for everybody a completely safe and healthy pregnancy. In cystic fibrosis, I think that we should think of all these women currently as being high-risk pregnancies, and would recommend that their obstetrician would be a high-risk obstetrician, such as Edith is. Regarding who will do well or how she can optimize her health, optimizing lung function and optimizing weight would be the best, even prior to conception, to get her through the pregnancy as well as she can.
So, Edith, what do you tell? Moira has just referred a woman with CF who's considering getting pregnant to you. What do you tell her?
I continue on that discussion. I underscore what the nutritional status. I underscore pulmonary health. We also sort of talk about the work that it takes through the pregnancy. So, for example, for someone who may not be as rigorous about, pulmonary health or even nutritional status, that person is really going to need to ramp up during the pregnancy. So there needs to be sort of an adjustment in attitude. I think that they're going to, it's not uncommon for them to see their obstetrician more frequently. So if there are going to be issues with work and taking time off from work, they need to, talk to their provider and their employer about this. I also do think that there's an increased risk for having pulmonary exacerbations that we would like to treat as an outpatient, but it's not, but one has to prepare for the possibility of being admitted for treatment. So I think that there also needs to be an adjustment in that regard. I think that our pregnant moms, get tired more, and that they slow down more so in the third trimester. So their partners, families, moms, aunts and uncles sort of need to come in and help out with taking care of them. So I talk about that process during the pregnancy. I talk about postpartum in that, I think that we focus on, let's get through the pregnancy, we're going to be healthy, and then we kind of forget about the postpartum, which is also as Moira and I discovered as we looked at our series of moms in Seattle, that the postpartum period was actually a very fragile time for them, that they do get sick, that they lose their weight very quickly. And I think that that totally makes sense when you think about new mom, she's tired, she doesn't have time to take care of herself, she's not eating, she's not sleeping. And so our CF moms are at very high risk for losing their weights very quickly, which is what we observed, and getting sick. So I talked to them about that.
So let me ask this, because you mentioned more frequent pulmonary exacerbations or lung infections. Does lung function drop, and is it irreversible in a woman with CF who's pregnant?
Well, excellent question. So Edith is right. We have seen more acute exacerbations during pregnancy, and nationally that's been shown in a database as well. So that is clear to be anticipated. But the lung function goes up and down with those exacerbations, but overall it actually stays steady. Interestingly, again from the cystic fibrosis registry, we did show some years ago that women who have successfully had a live birth, however, do not have a decline in their lung function. In fact, it was an indicator that they did better than those who didn't have a live birth. So a little rocky during pregnancy, but postpartum, the long term is excellent.
Well, that's good to hear.
That is good to hear.
I want to go back to something else. You had mentioned, Moira, that nutrition, good weight, good lung function help with a pregnancy. Are there any other markers or any other things that need to be taken into account before a woman with CF gets pregnant?
The one other issue that comes up relatively frequently is cystic fibrosis-related diabetes mellitus, and to be aware if a woman carries that diagnosis with an oral glucose tolerance test, as should routinely happen in all CF women, but before the conception, and of course during pregnancy at week, I always forget this, Edith,
28,
excuse me. At week 28, women go through a glucose tolerance test, because normal women, to make sure they're not getting gestational diabetes. And so that would be another issue with weight gain. Women with cystic fibrosis do not gain the weight that a non-cystic fibrosis woman gains. I think the average is 28 pounds, and we do fall short of that, both locally and nationally. Despite maximizing nutrition during pregnancy, that weight does come off the mother, and the babies are born at the appropriate weight, but the mother actually in of herself loses weight really because of the pregnancy.
So a woman with CF can have healthy babies, but their nutrition may be less, or they may have a harder time with their weight. G-tube or tube feedings seem to be more common in cystic fibrosis. Are they used in women who are pregnant who also have cystic fibrosis?
We don't. We don't. I think that Moira and I had an experience with a G-tube with one of our patients very early on in our experience together. And we found that that was not successful for several reasons, I think. One of which is that the uterus grows, and as it grows, it actually kind of knocks the G-tube around or it kinks it. And I remember, having to call the surgeons to come in yet again to sort of futz around with that G-tube. The other thing that was really funny, now that I think about it, was that as the uterus sort of got up to here, the baby would kick the G-tube around and would kink it. So we did not find that I did not find it satisfying in terms of getting the weight on this particular patient. So in our institution, what we've done is go to TPN, or total parenteral
nutrition. And the other big issue with the G-tube during pregnancy is reflux is a problem during pregnancy, and of course the feeding with the G-tube is difficult because of that.
So how How safe is it for a woman with CF to get pregnant, to have delivery? What complications might she face during pregnancy and delivery? I know we've talked about it bits and pieces, but
I think overall it's safe.
Mm-hmm.
I think that it's I think that the care of this woman, it just requires sort of meticulous detail.
Mm-hmm.
Making sure that she gains her weight, making sure that you intervene early enough. So sometimes in our practice for our women who are not gaining weight adequately, rather than having the normal OB interval visits of every 4 weeks during the first half of the pregnancy, they come in every 2 weeks,
mm-hmm.
because we need to know what's going on with their weight, and we intervene pretty aggressively and quickly early on. You don't want to be at 28 weeks to 30 weeks going, oh my goodness, you've only put on 5 pounds.
Mm-hmm.
You're behind the 8 ball.
Yeah.
So I think that it's a joint venture.
Mm-hmm.
Mom and her partner need to be on this, sort of meet us part of the way. So if we maintain good weight gain, if we maintain pulmonary health, there is every reason to expect a term appropriately grown
mm-hmm.
baby. We found that in our personal experience, I think. And term pregnancy is really 38 weeks of pregnancy or greater. The other is, delivery. There's no reason that just because you have cystic fibrosis that you need to have a C-section for delivery. Mm-hmm. We have vaginal deliveries, and actually, if you think about it, our moms do better with a vaginal delivery because, one, they need to get up afterwards, and they need to walk around, they need to cough. You aren't able to do that very effectively if you have a C-section.
Mm-hmm.
So, we do C-sections on our moms for obstetrical reasons, not because she has cystic fibrosis.
Interesting. Moira, any experience or additional comments?
No, I think that
summed it up nicely. Excellent. No, go ahead.
It was just the number of visits that
mm-hmm.
Edith is. We do very closely monitor the moms, and they have almost double the number of visits that a non-cystic fibrosis woman would have. And so it is quite labor intensive for the patient to get these excellent outcomes, but very rewarding at the end to have a lovely, healthy baby at the end.
So let me kind of go back. The woman who had sent in the 26-year-old, they're planning to get pregnant. So things are going well. She's talked to everybody. She's in the process of trying to become pregnant. At how long does a woman with CF, can a woman CF try before she maybe gets referred to an infertility specialist?
So the definition of infertility is if you have been trying to conceive with regular intercourse for a year, then that is a definition of infertility. And at that time, certainly either her primary physician or the cystic fibrosis physician would certainly be sending her to a fertility expert or a obstetrician, depending on what is locally available.
Mm-hmm. Okay. I want to touch on genetics. Someone wrote in and wanted to know what are their chances of passing CF to their unborn child if their partner does not have cystic fibrosis?
So if a woman has cystic fibrosis, then all her children have to be carriers. But if her husband or partner does not carry the cystic fibrosis gene, then none of the children will have cystic fibrosis. All will be carriers.
And what point in a pregnancy will a woman know whether or not her unborn child can be tested to see if they have cystic fibrosis?
So that's a great question. Currently, prenatal diagnosis of the fetus occurs either at approximately the 12th week of pregnancy by a procedure called chorionic villus sampling, or CVS, where we actually biopsy a little bit of the placental tissue or villi, and we can evaluate the presence or absence of the cystic fibrosis gene in that. The second procedure that, is genetic amniocentesis, which is done between 16 and 20 weeks of pregnancy, where we withdraw some of the amniotic fluid that surrounds the fetus, and likewise evaluate the DNA for the CF mutation. CVS carries a risk of about 1% for loss of the pregnancy. Genetic amniocentesis carries a risk of about 1 in 500 for loss of the pregnancy. So prior to delivery, those procedures would be the only procedures that will allow us access to fetal tissue to test for DNA.
Okay, so let me throw this out again from genetics. Woman with CF, married to or has a partner, they're having a baby. The partner has been genetically tested and is determined to not be a carrier of the cystic fibrosis gene. What is the carrier status of the child, and is there a risk that the child may still have cystic fibrosis even though the partner is a negative for a carrier?
Well, that's an excellent question, and comes up because it's very confusing often, because it depends what negative means. The partner being negative, are they truly negative? How many of those 1,500 different CF genes were tested or were screened for? If they truly were all screened, then indeed the child will not have cystic fibrosis. But if it had limited screening, if 20 were checked, 98 were checked, there is a very small chance that the child might have cystic fibrosis, about a 1 in 600 chance. Small, very small chance. So where the blood went to, very important question.
So for whatever reason that chance hits, the child does have cystic fibrosis. The mother has mild cystic fibrosis. What's the likelihood of the child also having mild cystic fibrosis?
Another wonderful question that comes up. The child may or may not have the same cystic fibrosis genetic makeup as the mother. It depends on what the cystic fibrosis gene of the father was as to whether that's the case. And then the other big issue is modifier genes, genes that are not the cystic fibrosis genes but modify the clinical presentation of an individual with cystic fibrosis. And as the child only has half the genes from the mother, then the child may be different in their cystic fibrosis presentation, may be the same, may be better, but may be worse. So you cannot guarantee if the mother has very mild disease that the child will also have very mild disease.
So a person submitted the question, does their CF maintenance drug therapy routine need to change when they're thinking or trying to become pregnant, or when they're pregnant? Should they stop some of their routine CF medications?
They should be very, as Edith pointed out, they should be very compliant and do all their maintenance therapy. I'm not sure if the question you're going on to is to what medications are contraindicated if they are pregnant.
I guess I'm looking at the basic inhaled medications, etc.
I think that when questions are, is flutter going to hurt my pregnancy because I feel like I'm being shaken up? The vest. The answer is no. You need to do it. Your exercise is just as important prior to pregnancy as it is pregnancy. It's not going to hurt the pregnancy. All of the medication, your pancreatic enzymes, all of that is absolutely necessary and should be continued during the pregnancy.
Because based on our conversation, because you really want to keep lung function the best as possible and your weight the best as possible, so maintaining your medications are not going to hurt the pregnancy and should be maintained. And so there really should be a close working relationship between the physician and the CF healthcare team, along with the obstetrician in dealing with the pre-pregnancy preparation as well as during pregnancy and delivering postpartum.
That is true.
We're on the phone with each other all the time.
You can tell.
Yeah, it's okay. Oh, it's Moira.
I'll call her back.
There are some antibiotics that one that one gives pause to during pregnancy, and in fact, my pharmacist won't let me prescribe them without Edith's okay. Intravenous aminoglycosides, for example, can lead to ototoxicity in that first trimester, particularly. But it is an issue, so one has to be aware of the medications that may be contraindicated during pregnancy.
So it's not that they shouldn't do the medication, but they really should work closely with their physicians, both the obstetrician and the CF healthcare team, to make sure that they're on the best medications that they need to be on to treat whatever's going on and maintain a healthy pregnancy.
And I think the other point is that, you know, and I think I can speak for Moira, is that there are lots of antibiotics that are safe in pregnancy.
Most, almost all.
Yeah, most, and actually, and that we would not compromise a mom's pulmonary issues and her pulmonary exacerbation, you know, because of issues of antibiotics. I joke a little bit, but Moira and I and the pharmacists are on the phone together trying to figure out, okay, what are we going to use? Because that's really important.
So let me ask the last question, and I'm excited that I even get to ask this question, and that is, how does cystic fibrosis affect a woman going through menopause?
I love that question. Well, but it is not. It's a true question because, as I understand it, the registry has 500 women who are now 45 years or older, and the 3 women in our group used menopause as a form of contraception, but I have very little personal experience with that, and it's certainly an area for future research. As far as we would know, apart from perhaps those night sweats affecting their sweat glands, we think that the menopause in cystic fibrosis women is like for all women.
Well, thank you, Edith. Thank you, Moira. We encourage you to have an open discussion with your CF doctor or your primary health care provider or your obstetrician related to fertility and cystic fibrosis. You can contact the CF Foundation to obtain the pamphlets Sexuality, Fertility, and Cystic Fibrosis Information for Adults or Day-to-Day Thinking About Having Children. You can also find information about female fertility on the National Institutes of Health's website, medlineplus.gov, or from the American Society of Reproductive Medicine at asrm.org. Please remember there are more webcasts archived on the CF Foundation website. I wish to thank you for watching and submitting your questions, Edith Chang and Moira Aitken for our lively discussion, Rick Vasta and the technical crew, Genentech, Melissa Chen, and the CF Foundation.